So I'm going to just give you a quick overview of what we do in the pain lab. So I'm going to go through some of the key testing that we do to measure how pain is expressed in the central nervous system. So one of the ways that we do that is by measuring pain thresholds. And today I'm going to test my participant Daniel's pressure pain threshold using this ergometer to determine the response to pressure. So to do this, I'm going to ask Daniel to let me know as soon as the normal sensation of pressure transitions into an additional sensation of aching or stinging. Okay, have you got that?
Yeah, I've got that.
Perfect.
No.
Okay, that's great. So one of the things we're particularly interested in this lab is understanding how these pain responses can be modulated using various different forms of neurotechnology. So we use everything from non-invasive brain stimulation to immersive virtual reality. And today I'm going to show you how we use immersive virtual reality to modulate pressure pain thresholds using the ergometer. So this is the virtual reality headset that we use, and I'm going to ask my participant Daniel to put this on. And what we're particularly interested in is to see whether or not this experience can change the way Daniel perceives the pain. So I'm going to do exactly the same thing that I did last time, Daniel. So I'm going to ask you to tell me when this transitions into an aching sensation, okay?
Yeah, okay. No.
So one of the things that we're particularly interested in here as well is understanding how pain changes during chronic pain states. And one way that we do that is by using electrocutaneous stimulation to sensitize the skin. So if I just take this virtual reality headset off you and now show you exactly how we do this. So this is the electrodes that we use. And to do this, what I'm going to do is ask my participant to put his arm out. And I'm going to place this electrode over the surface of your skin. And now what I'm going to do is deliver a very short burst of stimulation, okay?
Okay.
And what I would typically do is I would deliver this 5 times over the course of a minute. And by doing that, it would sensitize the skin to sensory testing equipment that would typically be considered as not very painful. So I'll show you what I mean by that. After sensitizing the skin in this way, what the participant would typically feel is a sort of sensitivity similar to that might be considered during sunburn. And by doing that, what we can do is assess the sensitivity of the skin using these calibrated sensory testing device that allows me to deliver a specific force to the skin, and that will in turn result in some sort of perception. So with this, what I would do is I would place this over the skin, over the area that I've sensitized, and I'll be able to see whether or not it's changed into a painful sensation. So right now, I'm going to ask Daniel to let me know on a scale from 0 to 100, how painful this would be. 0 being no pain at all, 100 being the worst pain imaginable. Okay?
So about 15.
Perfect. So that's would be considered a painful response, which has been induced via this sensitization process. So the main reason for doing all these types of experiments, particularly the sensitization of the skin and understanding how that changes the perception of pain, is to then see whether or not we can modulate those responses, again using virtual reality or non-invasive brain stimulation. Because ultimately what we want to do is use these techniques to then transition into the development of chronic pain therapies for chronic pain patients.